Thank you all so much for joining us. We're really excited to have you here as we talk about DBT for families. My name is Samantha Barron. I know some, but not all of you, so it's a pleasure to e-meet. I'm the clinical outreach coordinator in the Northeast. A little bit of housekeeping before we start. We do want this to be a networking event, so even though we can't all be in the same room together, we do want to facilitate networking and connections. So please do leave your contact information in the chat so that we can continue to share resources even after this hour has passed. And during Kate's talk, we ask that you please hold your questions. If you do have a question, go ahead and type it into the chat. I'll collect them and deliver them to Kate during the Q&A. I'll tell you a little bit about Clearview treatment programs. Clearview has been serving the community since the year 2000. We have 3 different programs under the Clearview umbrella. Our Women's Center for Borderline Personality and Emotional Disorders is a women's residential program where we specialize in providing comprehensive dialectical behavior therapy for women struggling with borderline personality disorder, emotional dysregulation, mood and anxiety disorders, PTSD, suicidality and self-injury, and other personality disorders. In addition to DBT, we offer cognitive behavioral therapy, acceptance and commitment therapy, seeking safety, and other evidence-based modalities to help our clients acquire the skills that they need in order to self-regulate. Our other residential program is the Center for Addictions and Mental Health Disorders that caters to both men and women who struggle with substance use disorder and co-occurring mental health disorders. At that program too, our therapists are intensively trained in DBT and other evidence-based modalities in order to best address not only addiction, but the emotional dysregulation that can go hand in hand with it. And finally, our outpatient program offers partial hospitalization, intensive outpatient, and outpatient programs to the populations I just mentioned, as well as men with primary mental health disorders. We can work with insurance at all of our programs, and we're in network with Anthem Blue Cross, MHN, and First Health at our dual diagnosis residential program and our outpatient programs. We're really glad that you're here with us today for this talk. If you have any questions about Clearview in general, or if you'd just like to connect, please do feel free to reach out to the outreach team, and we'll leave our information in the chat. With that, I'm really pleased to introduce Kate Roahrig. Kate is a licensed marriage and family therapist who is certified in DBT by the DBT Linehan Board of Certification and trained as an NEA-BPD Family Connections Leader. Her past experience includes working as an in-home outreach counselor, conducting therapy with families and individuals involved with the Department of Children and Family Services and suffering from emotional, mood, psychotic, and personality disorders. Kate also worked with John Briere and Randy Semple, studying the genetics of PTSD in patients admitted into the trauma units at LA County and USC Medical Center. At Clearview Women's Center, where Kate's worked since 2012, she's a DBT therapist and skills group facilitator. In that role, Kate leads DBT skills and CBT groups, provides individual therapy and skills coaching utilizing DBT, and co-leads our family program. Thank you so much, Kate. We're excited to hear your talk.
Thanks, Sam. All right, can everyone hear me okay before I share my screen? Awesome. Well, thank you so much for everybody joining this. And it is a short amount of time for us to fit a lot into the conversation. So I'm going to do the best that I can to make sure that I give you guys as much psychoeducation and basic DBT skills to really help bring into the sessions with your clients. And it's just the side note, it's kind of exciting for me. I've done a few of these and I've never done one from my office. So I feel like I'm like inviting you into my home away from home. So I do appreciate that too. Let's see here. I'm going to share my screen. It says it's disabled for me to share. If Lori, if you are able to help me with that.
All right.
There's always technical difficulties on these Zoom things.
Yes.
Get it together soon.
Sorry about that.
Okay.
Why don't, you know what? I can just bring it up if you want, and then you can just, I can run it from here if that's okay.
Totally fine.
Okay.
And also, while Lori's bringing that up, we're going to, tomorrow, all of the participants will receive an email with a link to the recording of this talk, because again, I'm going to be covering quite a bit, so it might be hard to really take in all the information. So you will have access to the recording of the talk, as well as we're going to give you a link to the slides. So just so you know that as you listen. Here we go. Okay. And Lori, will you be going to the next slide for me, or?
I will.
Okay, great. All right. So this, can everybody see this now at this point, I think?
Yeah, we can see it, Kate.
Great.
We need to put it in slide view, slideshow view. But go ahead.
Better?
All right. We're not seeing it as the slideshow.
We see the slides, but yeah.
So if you go to view and then slideshow, it should, or start slideshow.
Okay, hold on. Sorry, I have like 6 screens now opening and I'm trying to admit people in it as well. Okay, let's see. It should be on. Sorry, guys.
Okay.
All right. Let me see. I'm going to start the slideshow again and hopefully. Is it working? It's still not working, is it? I'm sorry.
That's all right.
Do it this way.
Let me see if I can do it this way.
Like everyone's getting a behind the scenes look of what we go through at every Clearview event. There's always this period of.
Is that better?
Right. Yes.
Yes.
All right.
Okay.
So we can go ahead and go to the next slide. Again, something that's so incredibly important, and I think those of you who are participating wouldn't be here if you didn't also understand and agree with this, is that families are extremely, extremely important to be involved in the overall treatment process. That it's not just, sometimes we can kind of, either as the family unit or as a provider, conceptualize the issues being solely an individual. But what we do know from a lot of research, and within DBT in particular, is that families are extremely important in the managing the crises that come up and the difficult moments that come up, and trying to work together to do something differently. So that is really what the goal of this talk is to give you a lot of psychoeducation on understanding how some of this comes to be, so that you can explain that to your clients. But also to have some skills that they can start implementing to not only understand what comes up for them or their loved ones in these moments that they're wanting to work on shifting, but also being able to more accurately express what they're noticing or express how they're feeling about it, and to have a couple of things that can help de-escalate when emotions are high and communications that are difficult. So families are extremely important, and if we could go to the next slide, there's been so much research on this, that the involvement that a family has, if there is a significant amount of it or something that's more effective than where we're currently at, we see in research that there is a decrease in the overall family's level of burden and grief, and an increase in the level of mastery. I think this talk is even more important with what's happening in the world right now, because there's all these new, very difficult, novel situations that the families we're working with have been kind of thrown into. And while they're doing the best that they can to figure out which end is up, how to navigate it, there's a lot of things that we can work on to have that be a little bit easier in an already difficult situation. So some of the ways that families might be trying to manage the new stressors that are there from being in quarantine or being a first line essential worker, figuring this out, that there's a lot of things that might be happening that are contributing to that already difficult situation being even more difficult. So working with our families to better understand what's happening and to have a few skills that we can implement to de-escalate and really have more effective communication, that's going to be so important in the long run and so important right now. So whether we like it or not, what we do within our family dynamic or with our loved ones is going to have some kind of an impact on the people that are on the receiving end of that experience. And again, this is where it can come back to that sometimes families really look for, it's a very natural thing to look at who or what is responsible for my suffering right now or for this difficult situation. And the idea is that we want to try to move away from the blame piece that is so natural to do when things aren't the way we'd like, and to come more to the way that I'm reacting or responding to this is impacting the situation as well. It's not just what's happening for this person, it's also how I'm engaging in this experience and my reaction to how I'm feeling. So we want to make sure we don't forget that it's all related and connected. Next slide. Thank you. So the first part, one of my goals of this talk is that we want to arm ourselves with psychoeducation. That this is often a starting point for families, is that we're in this mix of dysregulation or this difficult situation, and we want to figure out how to get relief from it. A very important starting point is to understand what's going on for us in that moment. And then once we have that understanding of how we work biologically, either it be whether it be that it's the way we experience emotions or specific behaviors that we struggle with, to first understand the psychoeducation piece around that, to then be able to go into and make it possible to do problem solving or apply other skills. So one part that is very important to start with is, if you have a client or family that struggles with emotion dysregulation, there's a whole model on this. And that would be a great place to start, of talking about, okay, there's this pattern that we get into, and there's actually a lot of science behind what's happening here that's making it even more difficult for us to know how to make heads or tails of the situation, for us to know how to navigate it. So there's a biosocial theory that's been developed based on all the research around this. And what could be helpful is to explain this to your families of, hey, there's actually rhyme and reason to why this is so difficult. Let me explain to you how we find ourselves in these emotionally charged situations. Is that one piece is that there's a biological wiring for experiencing emotions in a certain way that can make it really, really difficult to do things effectively in those moments. So there are three components to the biological aspect. There's a heightened emotion sensitivity, which means that the threshold for experiencing emotions is lower than what it might be for someone who's not wired this way. So you experience emotions in a really big and colorful way, and that's all of this is fine. There's no issue with experiencing emotions in this way. There's also a high reactivity to emotions. So the threshold for experiencing emotions is low, and you can experience them more quickly than people who aren't wired this way. You might even be more attuned to other people's emotional experience, which means that if you walk into a room where someone is really struggling with intense sadness, that you may yourself start to feel and notice sadness. And that's part of the sensitivity as well. And the reactivity is that once we get an emotion going, the experience is really, really big. And for anybody, even if you don't experience pervasive emotion dysregulation, for anybody, when we get to a level of distress that we're feeling very overwhelmed, the part of our brain, the frontal lobe, that can process through and think of consequences and mediate and plan is completely compromised by this tidal wave of emotion. So we're really not in a position to try to have these important conversations or try to decide important decisions when we're feeling very dysregulated, because the part of our brain that can really work through that is offline. And then the last biological piece to the biosocial theory is that there's a slow return to baseline. So again, doesn't take much to experience an emotion. The experience is really intense. The volume is turned up on the emotion. And then there's a slow return. It takes a long time to come back to baseline, whatever that is for the individual. And what happens there is that we might be walking around trying to get some space from how we're thinking, and our dysregulation is very slowly coming down. However, life keeps going. And so while our dysregulation might be coming down to a little bit lower level, we might then have an interaction that's also upsetting, and we're already right here. So it doesn't take much to bump right up again. And that is what leaves us more vulnerable to those dysregulating moments. And so all that's fine. We'll make sure that we express that if we're giving this piece of psychoeducation to our clients, is that there's nothing wrong with that. The part that makes it tricky is when the environment, even to their best intentions, doesn't know how to support that and inadvertently might invalidate the person. So that's the social aspect of the biosocial theory, to work with your clients if you're in a family setting, of understanding that this is how this individual or members of the family might experience emotional moments. And then the way that the environment responds to that is incredibly important. A lot of the times, an example of an invalidating response that might be inadvertent in a family setting is that typically in the parent-child relationship, if you're hearing that your child is having a hard time, the knee-jerk reaction is, let me help come up with an idea of how to get relief from this, how to problem solve. And what we do a lot of work with our parents, it's not just parents, but that's a typical role that comes up in. But what we do with the loved ones and understanding what happens there is that we really work on using a skill that we're going to talk about near the end of the talk called validation, where we're not engaging with the knee-jerk reaction of saying, well, this is what you should do, or, you know, if you did this, then you wouldn't feel that way. Really trying to problem solve, that often feels incredibly invalidating, even though it's coming from a place of trying to support the person, trying to help them get relief. So what we want to understand with the biosocial theory is that when we oversimplify the solution or the process of getting relief, when we tell a person that they shouldn't feel that way, or why are you still upset about this? Again, with the slow return to baseline, if that doesn't happen for someone in the family, they might not understand that they might move on more quickly than the person who is wired to experience emotions this way can. They can't move on that quickly. The return is slower. So noticing that when, you know, you're going to respond to the individual of, it's not that there's a timeline, they can't just get over it, that can feel very invalidating when we go in that direction. Things like that, because over time what happens, and the environment can be anything that the person comes in contact with. It's not just the family that can be the invalidating environment. It can also be school, peers, community groups that you're a part of. Any of those environments can have an invalidating response to what the person's experiencing. And what happens is that over time, the person internalizes that, and they start questioning how they're feeling, and they start getting disconnected from how they're feeling and how they think they should be feeling, or what the process is to get relief from that. So the first thing that could be helpful, if this feels like this is something that you notice comes up in families that you work with, that there's someone who has a sensitivity to emotions or experiences pervasive emotion dysregulation, that giving some psychoeducation on, hey, there's actually a lot of science behind this, that in itself can feel very validating to the person or the family of, oh, there is, there's words, there's language I can put to what's happening. It's not just this storm we get caught in, it's that there's rhyme and reason to it. And there's things that we can work on doing that can help make this look and feel a little different. We can't change the way we experience emotions. We can change the way we respond to it. Next slide there. And so we can move through these fairly quickly because I was just explaining them, that with the biological piece, there's that high sensitivity, a high reactivity, and a slow return to baseline. And then the social aspect is that the environment, whether meaning to or not, a lot of the times we don't mean to invalidate, it comes out that way. And invalidation is an experience a person has where they're feeling misunderstood or judged or wrong with how they're experiencing something. So the social piece is incredibly important too. And this is a bit of a depiction of what that interaction looks like, that transaction between the biological way we experience emotions and the environment. That back and forth that keeps happening leads to pervasive emotion dysregulation. And what that means is that the umbrella, we'll go to the next slide in a second, but there's an umbrella of emotion dysregulation, and that leaks in. It's pervasive because it's leaking into all these different areas of our lives. And a lot of the behaviors that we might be struggling with are an effort to control or manage that emotion dysregulation. We can go to the next slide, thanks. So in DBT, we conceptualize these 5 areas of dysregulation that we see. Again, there's the overarching umbrella of emotion dysregulation, where we see the changes in emotions that can be fairly quick. The emotions are intense, and there's a big effort to avoid, which we'll talk about in the next slide, but there's an effort to avoid these unpleasant and intense emotions. That's often where down in the behavior dysregulation category, we see suicidal behaviors or self-harm, is that the emotions are so intense and the hopelessness around it changing and not knowing how to manage it is what often leads to self-harm and suicidal ideation. And it's not that the person really wants to end their life, they would like the pain to end, understandably, and they just don't know how. So the other areas of dysregulation that the trickle-down effect happens with pervasive emotion dysregulation is that we see it come out in relationships. The person might experience chaotic relationships with others. They might have a fear of abandonment. There's a lot of dysregulation within the self, that there's a difficulty understanding or connecting to your own identity. Sometimes what we see is chameleon-like behaviors where a person will take on the traits of people around them because they don't really have a good sense of what that means for them or their identity. There's feelings of emptiness or boredom, low self-esteem. If you don't have a good sense of yourself, and if you feel like at every turn you're not able to manage what's coming up for you, or that there's something that's wrong with how you're experiencing things, there's going to naturally be a lowered sense of self-worth or self-esteem. And that also creates a lot of self-judgments, that there's a cycle there too. And the behavioral dysregulation that comes from pervasive emotion dysregulation is often as a means to cope with that emotion dysregulation. So that's where we see the self-harm behaviors, the suicidal behaviors, the impulsivity, is that the impulsivity is coming from a place of high emotion dysregulation and not being able to think through logically what might happen if I engage in this behavior that could not be great. It's that reactivity because our frontal lobe is not online when we're very dysregulated. And the suicidal behaviors and self-harm behaviors are a means to manage the emotion dysregulation and avoid or escape the emotional pain that it can be looked at as more motivating to self-harm to focus on physical pain versus emotional pain, which feels very intolerable. And then the last area of dysregulation is around thoughts. That when we're experiencing intense emotions and we're having trouble managing them, that there are thoughts that go with that and they feed off of each other. The way we think about something is going to influence how we feel. That's another important thing to start connecting with families that we're working with, is that that's the model I'm about to go into in a moment. There's a direct correlation between ineffective coping techniques and behaviors and behavioral dysregulation and negative emotion and the way that we're thinking about those emotions. So this is another area that's important to work on identifying with the families you're working with, and we'll talk about a skill set to help get the family started on noticing that for themselves as well. Next slide. So the model, there's another model. Psychologists love models and acronyms. And another model that we want to look at is that within families that struggle with substance use or addictive behaviors, that there's a model that might be helpful to share with them that, hey, this might be what's happening, and just be curious with them and look at it and see. This is also a model, I know it says that it's self-harm as substance use, but the emotional cascade model has been used with eating disorder behaviors. It's been used with borderline personality disorder. So it's something that's salient with each of these areas, because the base of all of it comes back to, there's this pattern that happens for individuals, is that something, the emotional stimuli is referring to, something happens in the environment around us that triggers or cues sensitivity to emotions. We then experience something in the environment and we have an emotion about it. And then we get into this cycle that there's a positive feedback loop with us starting to think about the thing that's upsetting or difficult and engaging in unhelpful rumination around it, where it's not structured. We're just playing it over and over again, thinking about the things that are painful, trying to perceive or understand causes. And then the positive feedback loop refers to that the emotions feed off of that. So the way we think about things is going to influence the way that we feel about things, which then influences the way that we think about things, and back and forth. And so this vicious cycle occurs where the way to get out of it is to engage in a behavior that typically is going to be ineffective. That might be where we engage in the cutting behavior, or the disordered eating behaviors, or substance use, as this slide's referring to. That's our means to break that loop and avoid the negative emotions that are coming up from the rumination, is to do something to cope, to avoid. And then that is going to lead back to shame and guilt, perpetuate the cycle, and keep that going. So it's an important thing that if you notice, hey, this could be helpful in getting a foot in the door to have a conversation about a behavior or a pattern that this family might benefit from, really understanding that this is what's happening and there's a way out other than the way we've been trying to do it, which will be to utilize the skills, or if you're not a DBT therapist, to utilize the different techniques or approaches that could be helpful to also break that cycle and to engage in a more effective way with the emotional sensitivity that comes up from experiencing something upsetting. Next slide. So again, what that cycle and illustration is depicting is that there is that emotion dysregulation cycle that happens. The situation triggers the intense emotions, and then there's an effort, because no one wants to feel negative emotions. Most of the time we don't like feeling that way, and we'd like it to end and we'd like it to be different. What happens is that knee-jerk reaction versus responding to thinking about it, getting caught in the thoughts, having emotions raise even more because of the way we're thinking about it, and then to try to avoid by using substances or engaging in other what we call target behaviors, so ineffective coping behaviors that give you short-term relief. This is the way I like to frame it for clients is it makes sense that's giving you short-term relief, but it's for a long-term problem. So it doesn't match up. We're applying a Band-Aid to something that needs surgery, basically. So it's approaching it from that way of understanding that, hey, this is what happens. This is real. This is happening for you in real time. And there's a way that we can try to break the cycle that's more effective for everyone. Thanks. So what happens in those moments is when we get in the patterns and we're trying to go toward our loved ones when we're dysregulated or we're in those tough moments, is that it's really, really hard to accurately and effectively say, hey, this is what's happening for me and this is what I need. So we have also another model called the transaction model that we like to talk about because it's, again, if we can give people understanding of what's happening for them and then also give options for how to manage it in a way that's going to give them a life worth living, that's super important. And so there's this model called the transaction model. We're going to go through two different versions of it. This is the version that we're typically talking about in family work as, hey, this is what's happening that's just not really working for you guys, for anybody. It's not as helpful as you would like it to be. So if we're in an interaction, the example that I like to give in family class here is that if a loved one calls and says, hey, I just had a terrible day. Session was awful. Group today was a waste of time. I hate this place. What happens is that we see that top part of the transaction model there is that there's heightened emotion arousal. The person's dysregulated when they start the conversation. And then they're engaging in what we call an inaccurate self-expression, which means that they're talking using a lot of judgmental language, which is shortcut language. And we all use judgments, we all have judgments. It's just sometimes it's not really serving us in the way that we would like it to. The hope we have behind it just doesn't come to fruition when we use judgmental language, because it leaves so much room for misinterpretation. So the loved one then is most likely going to have an invalidating or inaccurate response when they hear this inaccurate expression. And so it's inaccurate. We call it inaccurate to call someone and say, I had a terrible day at program. Session was awful. Groups were a waste of time. The judgmental language within that is inaccurate because it doesn't truly say or tell the person, what was it that was awful? What was it that was a waste of time? And if we don't know that, this is where the problem area for judgments comes up, is then it's up to our own mind to interpret what that means. And it might be very different than what the person is saying. And so that's what leads to the invalidating response. So the loved one that's hearing that might come back and say, you always do this. Why can't you just get it together? I'm paying so much money for this treatment, or, I'm investing my time in helping support you, and you're telling me it's a waste of time. So that response is probably not what that person was looking for. And that would be where we'd want to coach our clients on more accurately. And this is where mindfulness is going to come in, that I'm going to talk about, more accurately describing, okay, what does it mean? Let's unpack that session was awful. Let's unpack what it means to have a waste of time, feeling that groups are a waste of time, and then go from there. And then that's going to help the person more accurately understand what is going on for them so they can more accurately respond in a validating way. So the way to do this and the way to really start coaching our clients is to employ mindfulness. Mindfulness is the key. In DBT, mindfulness is the foundation of every single skill that we use because it's important. There's so much time and effort spent on not being present because the present feels intolerable. But it's often that we're getting pulled to the past or the future, and that's what's creating the dysregulation. And so mindfulness is the foundation of all of the skills that we talk about, because if we're able to non-judgmentally be in the present moment, then we're going to be able to utilize skills and have them be more effective than if we're trying to use a skill but also ruminating about the thing that's upsetting to us. So with the skill of mindfulness, the goal is to really, as a family member or loved one, to try to start working on observing, describing, and participating without judgment. So we'll go to the next slide to talk a little bit more about that. In DBT, we have two sets of skills in mindfulness. There's the what skills, what we would like to be doing when we're being mindful, and the how skills. This is how we're being mindful. And with the what skills, we have observe, which means to just take in the stimuli of the environment without putting a descriptor to it. This is really challenging because it feels a lot of the times like those happen simultaneously, that I both observe and put a label to it at the same time. So the real practice with our clients will be to find the space between, because that is the space that's going to be your best friend on when we get in these moments where things are really, really difficult or emotionally charged. We're practicing responding to what's happening for us versus reacting, where it's that quick shift and I feel something, I do something. We're trying to find the space of, I feel something, I'm noticing that, I'm trying to objectively, non-judgmentally describe that to myself, and then I'm deciding what makes the most sense to do next to have it not get worse. And that's participate. And the how skills, how we're trying to be mindful, would be, again, if you notice judgments, we all have them. It's totally fine to notice them, say them out loud. That's important too. But then to check in and see, how could I unpack this more? What does that actually mean? So with the example of session was awful, what does that actually mean? In session, we talked about something that brings up a lot of intense emotions for me, and I really had a hard time managing urges to, ineffective urges like to self-harm or, to avoid because of that. So that's already giving not only yourself, but also whomever you're interacting with a more accurate idea of, oh, that's why it was awful. That helps me know how to validate, which we're going to talk about next. And we want to also try to be as one mindful as possible. The world we live in really often gives us rewards for not being mindful, for doing many things at once. And that's just not helpful to us to be able to be in the moment and really take in what's coming up for us or what makes the most sense for us to do in response to something that we're experiencing. And so what we want to do is really try to notice when our mind is wandering or not one mindful, and notice it and bring it back. And that would be a great thing to work with your clients on, being able to catch that. It's not that we notice it and then we judge ourselves for not being fully mindful. We notice it because this is what minds do, and then we try to come back. It's a muscle that most of us don't often flex, so it takes a lot of work and a lot of time to really get in the groove of that. And then effectively, which is the last how skill, is the most broad range skill that we have. And this is where you really take a look at, okay, what do I need to do in this moment to have things not get worse? If we're in a back and forth with our loved ones and we're noticing that we are having a disagreement and I'm very polarized in my point of view and my loved one's very polarized in their point of view, the effective thing to have it not get worse wouldn't be, let me keep saying over and over why what I think is the way to go. The most effective thing to have things not get worse would be to, in that moment, as much as we might want to keep going, to say, I think we're hitting a wall here. you know, agree to disagree, or let's take a break and come back to it because I really would like to keep talking about this. I just don't think that this is going in a direction that's helpful for either of us, or I'm having a hard time being able to stay in the conversation with you and I really want to hear what you have to say. I just know for me right now, I've got to take a break. So that's how we might use mindfulness with them. And if it's something that's very new for everybody, a practice that I'll often suggest in family class here is to practice the what skills and the how skills. Start by turning on a water faucet and put your hand under the faucet and just notice, try to stay and observe as long as you can, where you just notice the pressure of the water, where you just notice the feeling of the water temperature changing. And then you move into, after you've gotten like a moment of that space between observe and describe, you then move into, I'm noticing that the water temperature started out cool and got warmer as I kept my hand there. And that's using the non-judgmental descriptor. And that can be a great way to practice using these skills if it's something that's very new with a really innocuous, no stakes situation. Right, next slide, please. So relationship mindfulness is incredibly important. This would be one of the first tools, again, beyond psychoeducation to use around DBT skills with families, is that in order for us to really be able to increase effectiveness in conversations, we've got to bring in a level of relationship mindfulness. So it's the skills that I was just talking about with mindfulness, but this added layer of complexity of being not only aware of how I'm feeling in a present moment, but also what I'm noticing, hearing from, and how I'm feeling about an interaction with another person. And so it's so hard at times to be really in the present moment with our loved ones or with other individuals. And yet this is really the foundation for being able to have more effective communication or make changes in the family dynamic. And we do this because being able to be mindful in relationships helps us, we come back to that transaction model, which we're going to look at in a second. It helps us to come back to really better understanding, more effectively and accurately expressing how we're feeling, but also better understanding how the other person is feeling. And this is going to allow us to do the next super important skill, which is to validate each other in those moments. So let's look at what this looks like with the transaction model. That the one I was talking about a few moments ago was that the ineffective pattern that we can get into is that we inaccurately express how we're feeling, which makes it so much more likely that we're going to get an inaccurate or invalidating response. And so that's our motivation that we can work with our clients on, is you're doing these things, you're making this effort to get support or to reach out when you're having a hard time. When we do it in a way that's not accurately depicting what's happening for us or stating what we need, you're actually putting in all this work and not getting the result that you're really looking for and your family is really looking for, which is to support you. So by using the mindfulness skills of noticing what's coming up for me, noticing if I'm having judgments and trying to unpack those, and then trying to express that, I'm going to make it more likely that I'm having a conversation with my loved one, that they're understanding how I'm feeling, and they're going to give a response that's more in line with what I'm looking for, that's more supportive or understanding. And that leads to a lower emotion arousal. So we see that time and time again, that if I'm having that initial call where I'm not accurately expressing, I'm saying group was horrible, session was awful, group was a waste of time, and my loved one moves into an invalidating response of, you always do this, you always say this, I'm using all my money, I'm trying to support you, and you're not doing the work. That's more likely going to keep emotions high or make them go higher, and then we get caught in that loop. So if we're able to use skills where we're saying session was really awful, and then unpacking that immediately. If session was really awful, I was talking about something that was so difficult for me, and I noticed that I wasn't able to use the coping techniques I usually use, and that was really hard too. Then the loved one or the person we're talking with is better understanding. They're not trying to come up with an interpretation, and they're going to hopefully, not always, but hopefully be able to say, that sounds really, really tough. I don't know how I would, respond in that situation either. It sounds like you made it through a really difficult day, right? So again, this is why we do the difficult thing of trying to be more mindful in these moments, is that when we show up, not just for ourselves, but in an interaction with more accurate expressions, more mindfulness of what's coming up for us, it's going to decrease emotion and reactivity. That we're not just having an emotion and reacting. We're having an emotion, we're noticing that, we're thinking about, what do I need to do to have this not get worse? And that actually opens the door for the next skill that's really key to de-escalating and having effective conversations, which is validation. And it makes room for us to be more willing in those moments if we're able to be non-judgmental, if we're able to really observe and describe accurately what's happening. So again, coming back to that thing we talked about at the beginning, is that what we do in those moments does impact what's happening in the interaction with our loved ones. It's not just, my loved one is struggling with these behaviors, they need to deal with that and work on it. We've all got to work on changing the dance steps, and this is a way that we can start doing that too, and how we're having conversations and responding to each other. So the next skill that we're going to use when we're talking about validation, can we go back one real quick, please? Thank you. Is that validation is being able to demonstrate or communicate our understanding of what another person's experiencing. If we can all think of times where we have felt misunderstood, then we can probably also imagine what that feels like, and that makes it really hard to have effective communication and to keep staying in the conversation. If we can think about a time where we felt like someone really heard us and understood when we were having a hard time, that typically brings down emotion dysregulation in itself and can make us more open to having a conversation, even if it's about something that's really difficult or we might have a hard time hearing. So this is where we establish or acknowledge what we're hearing from another person, and there's lots of ways we can do this. So we want to let our clients know, hey, this can be really tricky to do. It can be hard. Validation isn't something that I say this phrase and the person feels validated and then we're good. It's that it takes time and practice to figure out how to say it, what to say it, when to say it. That's where mindfulness comes in. And then also know that the person might not receive it as validation, and that's okay. We just will want to keep working on finding ways to validate that feel validating. Okay, so we just talked about this a little bit, but the bottom part there that I do want to also discuss is that validation, one of the biggest misnomers that we get about that is that, well, I don't want to validate when my loved one uses alcohol or smokes pot to manage emotions. I don't want to validate that. I don't want to reinforce that. I don't want to make them think I'm okay with that. That's not what validation is. Validation is saying, hey, I'm here with you in this moment. I'm trying to understand. And we don't want to validate the invalid by saying, oh, yes, of course, when you were feeling really anxious, absolutely, you should have smoked pot. We're saying, oh, it makes sense that that urge came up for you because that's how you've managed anxiety in the past. And, that's something that just doesn't help long term. So it's saying, I understand why that was the go-to, and I'm also not supporting that piece. So validation isn't saying I agree or approve of these things. It's saying I'm trying to understand or hear you. in this moment as to why this is happening for you, or how it makes sense that this is coming up for you, or that was the urge. And there are two ways that we can validate. We can do it through behaviors. That's called implicit functional validation, where if someone's crying, if I hand them a tissue box, I'm not saying anything, but I'm demonstrating that they're having an emotional experience right now. I'm seeing that, I'm noticing that. Or we can also do it verbally, which this is a way that we often will do a lot of coaching with families on, is through using words. So there's different levels. We can go to the next one there. There's different levels at which we can validate. And each one of these 6 build upon each other to feel a little bit more validating than the last. The first level is where we're not saying anything, we're just with the person. A lot of you are doing that right now by, paying attention. I really can't see your cameras, but I know that you're looking at the screen and you're paying attention. That is the first level of validation. You might be like nodding along. That's the first level. You don't have to say anything back, but that's showing that, you're with me in this moment. We can also think of what that might feel like to not even be a level 1. Is we've all been in interactions and conversations with people where they're on their phone, for example, and we're trying to talk with them maybe at a meal or something, and they're on their phone. That's not even level 1. Level 2 is where we're saying back, kind of mirroring back what we're hearing them say. So if a person, again, that example of I had such an awful session, or I had a really awful day, that the mirror back that we would do is, it sounds like you had a really awful day. So we're just saying back what we're hearing them say. Number 3 is reading minds. I like to call this reading between the lines. And this is where we're really opening ourselves up to getting some feedback from the person that we missed the mark with validation, that they don't feel validated. So reading minds means that we're listening to what they're saying, and then we're giving our summary or interpretation of what we're hearing them say. You've got an example there. The 4th level is you've got to know the person for this. And of course, if we're working with families, they know each other. So knowing experiences they've had in the past to make sense of what's coming up for them right now would be level 4. So the example here, given what happened with, going toward adopting a dog in the past, it makes sense that you're hesitant to adopting a dog. Things like that, where you're saying it makes sense what's happening for you now based on something else you've experienced. Level 5 is to normalize the current situation. That this is something that happens for most people in similar situations. The example here is, it's normal to be nervous before a job interview. And this feels a little more validating because we go back to that biosocial model that the person has experienced in their life over time. Hey, the way you experience emotions is not right. It should be different. And so being told, hey, how you're feeling right now is how most people would feel in this situation, that feels incredibly validating. It can feel incredibly validating. And the highest level of validation is called radical genuineness. This is where you really, no matter what the differential is, if it's a parent-child relationship, if it's an employer-employee relationship, whatever is the role differential, that's not there anymore. You're just responding as you would yourself as a human being. So the example might be, oh my gosh, that sounds horribly awkward. If, you spilled coffee all over yourself in front of somebody that you were really wanting to have a conversation with, somebody that you were romantically interested in. That sounds horribly awkward, or I feel anxious for you just hearing that. That can be the highest level of validation. And it's something that you've got to use a lot of mindfulness to know when to do that. And that you have what we call money in the bank with the person, that you have a relationship where you can utilize that level of validation, because otherwise it can kind of be off-putting. And so a quick guide that you guys can refer to when we look back at the slides, I know we don't have a lot of time and I want to hear your questions, is that you can work on this with your families of paying attention, using mindfulness to the verbal and behavioral expressions of what are they saying that they're thinking or feeling, what are their goals in this, what are their desires. So really using mindfulness to pay attention to what you're hearing from them in that. And when they're finished talking, to share your understanding of what they've said. So that would be level 2 or level 3. And if you feel stuck, share what you observed in step 1 and ask more questions to better understand and be open to feedback. And then again, we talked about this earlier, but the knee-jerk reaction for most of us is to help problem solve, to get relief. A lot of the times that's not what our loved ones are trying to go for. So if you have ideas for problem solving, invite them into that. Say, I have some ideas, but I don't know if you're open to them. And then the last piece is that when things aren't changing, it's incredibly important to talk with families about how to use the skill of acceptance to help reduce burnout. So we already have painful situations in life, day-to-day life, and when we push back and don't accept that, it creates avoidable emotional pain, which is suffering. And so we want to use radical acceptance to non-judgmentally accept reality as it is in this moment. Not that it can't change, but that, you know, I don't like this and this is what's happening right now. And that truly will, if we can work on that, it's not that you are always in acceptance, it's that we're moving in and out of it and trying to catch that with mindfulness and then remind ourselves, I don't like this and right now it is what it is. That's going to make room for problem solving and make room for feeling differently and being able to tolerate that emotional pain. And so the last thing that I think we have is some resources for you all so that you guys can look at that when you receive the link. If this has been helpful, if there's other resources you want to look into. But right now, let's go to the questions.
Thanks, Kate. That was a great and informative talk. We have a few questions in the chat. Sorry, we're running a bit over, but if anyone else has questions, feel free to post them here. So one question, could you redefine validation for us?
Yes. So validation is the act of demonstrating, whether it be through behaviors or saying out loud, this is my understanding of what's coming up for you right now. This is my understanding of what you're saying right now. So it's demonstrating through either words, going through those different levels that I quickly ran through of validation, or behaviorally by handing like a box of Kleenexes. It's just really trying to be in that moment with the person in a non-judgmental way.
And then there was a little bit of confusion about the mention of a water faucet. I was wondering if you go into the tip skills or how we can incorporate water into DBT.
So it wasn't about the tip skills, which is an acronym for crisis management skills. It's about a way, if mindfulness is very, very new, a really great no stakes practice is to turn on your water faucet, put your hand under it, and practice just noticing what it feels like to have the water hitting your hand, to have the temperature change, and to then describe to yourself, this is what I'm noticing. And that's a great way to start practicing mindfulness skills, to find the space between observing and describing non-judgmentally.
And might you have any tips if you're arguing with somebody who's, say, really dysregulated and they can get really argumentative or combative, any tips for how to engage or disengage in that kind of situation?
Absolutely. So in those situations, that is probably at the crux of a lot of family work, is how do we navigate that? Because as a family, we get into those moments. And what you'd want to do is, if you have an idea of what could be helpful, let's say, for example, you'd like to be able to point out to that person, hey, you know, I think we're going off track here. I'm feeling like we need to take a break. And so let's take a 30-minute, 40-minute break before we come back together, or however long. You want to have those conversations outside of those moments. So if you know what your limit is or what you'd like to try working on changing in those interactions, what the most important thing would be to have that conversation ahead of time. So then when you get in those moments of dysregulation and that pattern, you can say, hey, you know, remember we talked about this. I'm gonna go ahead and ask that we pause and let's come back to it, because it's really hard to introduce a new way of behaving in the dysregulated moment.
Great. And that is all of the questions that were posted in the chat. If anybody else has any more, feel free to post them here or ask them directly, or if they come up later, you can always reach out to us and we can get you an answer then. Well, thank you so much for joining us for this event. It was really great to have you here. We are looking forward to the day when we can host these again in person. Thank you so much, Kate. It was really great to
Thank
hear
you, everyone.